Sunday Business Page, part of KDKA TV's Making a Difference in Our Hometown. Here's Bill Flanagan.
Good morning. I'm Bill Flanagan, and this is a special edition of the Sunday Business Page. As part of KDKA TV's Making a Difference in Our Hometown campaign, we're focusing on people and companies that represent a new Pittsburgh economy, an economy based on technology and high-performance manufacturing that can help carry our traditional strengths on into the 21st century. You don't have to travel any farther than the Technology Center here on 2nd Avenue to see just how much times have changed. Here, high-tech research and development has replaced the basic industry that used to be at the heart of the local economy.
Transplant surgeons interact with engineers and machinists in this new Pittsburgh economy. Andrew Holmes is fashioning a new kind of artificial heart in a computer instead of his machine shop.
I can virtually build and model almost anything in this computer. They built the 777 Boeing airplane completely end-to-end in a computer, and between the computer simulation and the real life, I believe they were only off a 1/16 of an inch over an airplane that's absolutely enormous.
This sort of computer-aided design and manufacturing is old hat in the aerospace and auto industry, but it's potentially revolutionary in the world of medicine, where much of the development of new devices has been by trial and error. Dr. Bartley Griffith is a transplant surgeon with the University of Pittsburgh Medical Center.
Harvey Borovitz, our senior scientist, always says that in the past it's been seat of the pants. It is marvelous that we got as far as we did with this wonderful device, which was a seat of the pants, copy what God made, use the best materials available to get the job done, Jarvik heart.
And now with the intervention of technology, you get to something that doesn't look a whole lot like a heart.
It doesn't, but in many respects it's superior to the heart.
Here at the McGowan Center for Artificial Organ Development, scientists and engineers from the University of Pittsburgh Medical Center are developing an artificial heart. Their design has more in common with a jet engine than a Jarvik 7, with its chambers and valves that mimic a human heart, both in the way it works and in the technology used to create it.
We've learned now that we can design devices better than have been available in the past for patients. And the newer devices are going to take us into a whole new concept in terms of how we pump blood. We've turned things around a little bit, and we think something can be as simple as a garden hose pump. We don't believe necessarily we need to have a pulse. We can have a continuous flow pump that's very efficient and runs on the concept of a turbine.
Although other researchers are developing turbine heart pumps of their own, the Pittsburgh team is believed to be the only one developing components that rotate in a friction-free magnetic field, reducing the danger of life-threatening blood clots. And the unique use of computational analysis and computer-aided design helps to speed development.
The blue regions represent poor regions of flow. This would be regions of stasis, stagnation or reverse flow. So these blue regions are regions where the blood would stagnate and clotting would most likely occur. So you see in design 1, if we had gone ahead and built this, prototyped this design and tested it across the hall in blood, it probably would have resulted in massive thrombus formation or clotting. But you see in design 4, these blue regions are minimized. And so we have a much cleaner flow here. And let me say that all of these designs were based on human intuition. But
you were essentially using the computer to make the model, but you were still tweaking the model using your own sense of how it should be tweaked.
Right, using our experience.
The lab can create three-dimensional plastic models directly from the data stored in the computer and test them using lasers, video cameras, and special fluids. The technology dramatically reduces the need for animal testing.
And now what you're seeing are the flow of those little particles over the nose cone and over the leading edge of the blade.
The idea to have that flow be as smooth and uninterrupted and with the least amount of turbulence.
Precisely, as undisturbed as possible. That's our hypothesis. We believe that as we saw across the hall, high shear flow can damage the cells, and stagnant flow, just like stagnant flow in a river, a meandering river, will cause a coagulation of blood. That coagulation of blood can lead to a thrombus that can be extremely detrimental to the patient.
As the blood clots when it gets in one of these pools.
Right, as it's supposed to, as it's designed to.
The need for a permanent artificial heart is enormous, and so is the commercial opportunity a reliable device represents.
We think that with just a little bit of luck and good fortune, that this type of device will really be an answer to premature death from heart attack, and in fact will improve the quality of life of so many aging patients who have heart failure and spend much of their life in emergency rooms with congestive heart failure, and who spend a lot of their time not able to do all they want to do because they're limited in terms of their exercise. If we can prove what we believe to be true, what in our hearts we know to be true, that we can produce a very high quality device that provides a very good quality of life, we think that perhaps the American market could exceed 100,000 a year.
The Streamliner heart may be tested in animals later this year. It could be ready for human trials sometime next year.
Next up, capitalizing on Pittsburgh's strengths in healthcare and computer software. We'll see one local company that's making a difference by doing just that.